Namaskar. Welcome to another episode of Light, Camera and Ayurveda. Joining me on the show today is the esteemed Dr. Krishnan Mooss ET from Thrissur, Kerala. He is serving as the Executive Director at Vaidyaratnam Group and a proud member of the renowned Ashtavaidyan Thaikattu Mooss family. This family has been dedicated to preserving and promoting Ayurveda for over 2 centuries with a legacy dating back 200 years. The Vaidyaratnam Group, founded in 1941 by Ashtavaidyan E.T. Neelakandan Mooss, has remained steadfast in its mission to provide effective healthcare for all. Historically, the Ashtavaidyan Thaikattu Mooss family took care of the healthcare needs in the Cochin Travancore region. It is worth mentioning that the title Vaidyaratnam was bestowed upon the family by Lord Readings, the then Viceroy of India, in the year 1924. Acknowledging their significant contribution to the field of Ayurveda over the years, the Vaidyaratnam Group has evolved into a multifaceted entity encompassing various aspects such as manufacturing, research and development, and education, and more, all geared towards advancing Ayurvedic healthcare. Their dedication to this ancient science continues to inspire and uplift countless lives. Welcome, Dr. Mooss, to Light, Camera and Ayurveda.
Thank you, Ram. Thank you for having me in NirogStreet also.
How has the legacy of Vaidyaratnam Group, which has a very powerful legacy of 200 years, has impacted the value as well as the vision of Vaidyaratnam Group?
The family, known as Ashtavaidyas, or the families who took care of the healthcare needs in Cochin Travancore region, is a part of the Kerala. It's a middle part of the scene. So from that level, if we were just doing normal practice in home, we call it mana. It's a home. So there we used to take care of the healthcare needs. We used to make medicine in home, give to patients. There was no IP concept that time. There was OP patients who can stay at home if necessary. From that level, it got into next level. Maybe in early 90s. That time what happened was in 1900s. There was a shift that the British time was going on. The healthcare need was changing. So the need was in the Britishers also. So we were serving British government that time for the healthcare needs, their healthcare needs. So they're serving anyone who need the healthcare part of the society. From that level, we took into a Vaidyaratnam as a brand as soon as we got the title Vaidyaratnam from Lord Readings, as you mentioned, in 1924. So there was no concept of building a brand that time. The founder wanted to give a tag to whatever we are starting. So as a remembrance or respect to his father, he named it as Vaidyaratnam. That's how the brand started under the name of Vaidyaratnam.
Wow, wonderful, Vaidyaratnam Mooss. My second question to you. You very well, articulated in my first question about the group, how it started and everything. Tell me about how Vaidyaratnam Group has a strong focus on manufacturing. Vaidyaratnam Group's achievements has been recognized with the precious title Vaidyaratnam. How has this recognition influenced the group's work?
So I'll answer the second part of this question. Yeah. So how it influenced us. So whenever you are acknowledged by the society, your dedication level, your responsibility increases automatically. So that gives a lot of inspiration to do a lot for society. And it was our aim from the initial levels, whatever the medicines we are selling will only go to doctors. Because as a medicine, it's written on prescription, going to a patient, the value of the product will be more in terms of our ethical values and the usage of the medicine. As you know, our product can be used as a OTC way and in a prescription way, but the effect will be different. Single product can be taken on daily basis or a Rasayana concept. It's different. So these kind of recognition, like Vaidyaratnam title, whatever it is, it gives us more responsibility and inspiration to do further. And the other part of manufacturing, as I told you, initially it was just a small scale of manufacturing. Then it moved into 3 manufacturing units now. So from the initial stage, it was very difficult. At that time, difficulty was getting the raw material from the northern part of India and different part of the world to the village. Now there is a method of getting the raw material, but the raw material availability is not there. So there are 2 different issues at that time and now. The difference is there. But the challenges will be always there, but we have to make solutions for that. So now what we do in the manufacturing facility to make sure quality is, we have to look at the process flow and make sure the cost of production is less. Unless the cost is reduced and the patients get a good quality medicine in a cost-effective way, Ayurveda will be confined to a certain group, but affordability will be a great question then. So it's our aim that we make sure the quality products to everyone in the society in an equal way. That's what we're looking into, and the manufacturing, whatever we are making changes in the manufacturing area, will be aiming at this endpoint. So when you look at the process flow, when you look at the machinery, when you look at WHO, GMP, whatever it may be, end result should be a quality medicine for everyone in the society.
Wow, what a great way to take forward the legacy as yours. This is so amazing. We move to another question. You are yourself a doctor, am I right?
Yes.
And you have a legacy of being in the industry. Your family has been here for almost 2 centuries. How do you see research and development coming up in this category? How it is going to impact not just today, but years to come? How it is going to help us in mainstreaming Ayurveda as part of healthcare system?
Research is, I think, one of the best topics to talk about, and it can keep on continuing. So research can be in 2 perspectives, I would say. One is a industry perspective, one is a research perspective. So the other research perspective regarding the drugs, regarding the the diseases, genomics, everything's happening in one side. That everybody's discussing on that. The other part of research, I would say, regarding the process, to make sure we have a quality product, to make sure we have better quality norms, to make sure that the cost reduction is happening with maintaining the same quality. There's another research what's happening right now. So both research are required to ensure Ayurveda is available globally. Imagine we're taking Ayurveda into a country like America. So there will be some norms by the American government regarding the quality standards. To make sure that's happening in India, we need a certain set of research to check the feasibility of the research standards. Because you cannot make a Kashaya or Thaila in the standards what American standards are sometimes. So you have to do a research on that perspective. How to make that in the facility that been advised by the American government, or we can just have a word with them and try to teach them what is Ayurveda. So we need both kind of researchers. To teach them what is Ayurveda, we need the research like genomics and other part. So definitely research is going to be the base to take Ayurveda into global level and to communicate the way what the Western understand. Maybe it's English what we are not talking right now, but what is Vata with the Kapha? We have crossed that point. But to teach them further regarding the drug delivery systems, such as Arishtas, Asavas, Avartis, Kritas, we need a lot of research. Then only we can globalize Ayurveda. Then only we can tell them it's a science, not just a massage, not just a medicine.
Amazing, Vaidyaratnam. Now, since you are talking about goodness of Ayurveda, would you like to elaborate on something or say some success stories that you have seen with Vaidyaratnam and how it has impacted lives?
I just caught a story from my grandfather's experience because whenever we interacted with him from childhood, he always tell the stories were, from his experience. So I think it was a motivation for us. So there was a case of a 17-year-old girl having issue with her cycles. So that patient was treated by my grandfather, and random night, he got a call from the mother of this girl, and he was asked to come down because the patient was suffering from a lot of abdominal pain. So obviously he took one of the lady doctors from the hospital and went the midnight. So that time going to home was not a big deal because that was part of the process. A doctor is required wherever he used to go, he or she used to go. So he took the lady doctor, he went there. He assessed the patient. So obviously the patient was having a missed period, sort of issue regarding the periods were happening. Already she was under the treatment. So grandfather asked the lady doctor with him to do the procedure where it is mentioned in Ayurveda Samhita called Ashtanga, and the fetus is stuck. So she did the same procedure, something related to, like, we can call it something like a bicycle exercise we do in kids for the gastric issues. So she did something similar, explained in Samhitas, and the blood started coming out. The pain was because of the blood got stuck inside the uterus. So it is a simple logic which he used from the Samhitas. There was nothing medicine used, no panchakarma was did, but the pain was instantly cured. So there's one success case which I got inspired by not looking into so many things, but looking into things what I've learned until now. So we have learned 100 things in life regarding Ayurveda. So looking into each thing rather than learning another 1,000 things, that is much more important. Utilize what I have learned in the past is required for the future rather than learning 1,000 things in a single day. That's one of the success cases from my grandfathers. Regarding my personal experience, I would say there was a patient came to the hospital with rotator cuff tear. He was playing a football for one of the Kerala government team. He was suffering from severe right shoulder injury, and we could manage him with the Marma Chikitsa and some Panchakarma and some internal medicines. So after that, he rejoined the team and is successfully playing right now. So we took the CT once again, and the tear has also reduced. It's not completely gone in second CT. We are still continuing the treatment for him right now. Take at least 2 to 3 months to see the complete results. So this kind of cases really inspires us to do further, and whatever success stories we see, there is also things which are not happening on the other side. But that gives us energy to think forward. What is not happening? What is not working? Sometimes the concept, sometimes the patient. The main part is of success cases are how deeply you understand a patient. As I mentioned many times before, we are not treating a disease, we are treating a patient. If I give a kashaya to a patient who's working the night shift, he or she cannot consume the kashaya during the working hours. So how well you understand the patient, it's like a pendulum, like a Newton. How well you understand the magnitude of the patient, the location, the work life, the personal life, the food habits, everything. These adds up to the results, not just medicine and the Panchakarma. So understanding of patient is a key element for this success, I would say.
Incredible. I can actually imagine my personal situation where I was cured with very acute hepatitis and how Ayurveda came to my rescue. Then, as we see Ayurveda becoming more and more mainstream with multiple efforts, in fact, we have also seen global basically center of traditional medicine is being established, WHO working on it, traditional medicine becoming part of the mainstream in some ways. How do you see globalization of Ayurveda happening? Number one. And number two, where do you see the Vaidyaratnam's effort in this direction?
That's a great question because traditional medicine going to a global platform is not easy at all because it's a constant and continuous process, I would say. So earlier, many of us have discussed before, yoga became the global star. Through yoga, people started analyzing Ayurveda. So then they understood Ayurveda in a different way. But now the Ayush visa has come. So illness perspective has also come into the mind of people of other countries. So earlier it was about massage and wellness or the preventive part. Now the curative part or illness part also being discussed in global platform. For that, I think it should be a collective effort. Government itself cannot do everything by themselves. It should be a collective effort. See, for imagine maybe 1,000 doctors in a district. These 1,000 doctors can combinely develop a protocol for a single disease. For example, rheumatoid arthritis. If this protocol has been practiced and analyzed in a simple way, analysis platform, we can get more than 1,000 doctors seeing at least 10 patients of rheumatoid arthritis in a month. The numbers are so high. So those kind of SOPs are required when you're going for a global platform. Same time, Ayurveda is so successful because of its personalized effect. You're not giving a single medicine for everyone with same disease. It will be different according to the prakriti of the person, according to the components of the Vata, Pitta, Kapha in each of them. So there will be different combination will be given for same disease. So along with these SOPs, these concepts of Ayurveda should be also maintained. So when there is a mix of both, then only it will be successfully implemented globally. Otherwise, we can take it globally. But with true essence, if you want to implement, this concept of personalized medicine should be utilized. When you look into the Western medicine also, they are now trying to implement personalized medicine, which is the basics of Ayurveda. So rather than putting Ayurveda in a different way, you have to tell it is a personalized medicine. So when you look at aspirin also, they are doing research for a personalized dosages and all. There's a scope going on that way. So rather than running behind something, We should develop our methods in a scientific way. Personalized medicine, how to tell it scientifically. That should be the ideal way of taking Ayurveda to globally. But there will be hurdles. So one step by step we have to do it. First, you have to tell the world this treatment is effective for this disease. But how this personalized medicine added more value into this treatment. Thus, we have to take it forward. That's the ultimate way we can take it forward in a whole industry. Industry includes education, that includes medicine, includes healthcare, everything is included in that. See, once we have Ayurveda in other countries, we need healthcare providers in there. That include Ayurvedic physician, Panchakarma therapist, pharmacist, and everyone. To take it globally, we need to make sure we have good manpower for that. So it's not about medicine and treatment right now. For example, if you go to Spain, you need to know Spanish to treat a patient there. So if you really want to go globally, you should think globally. What's happening around you in other countries? How we can have a solution for that. If I want to communicate with them, how do you communicate with them? So this kind of thing should be there as an industry, our perspective. Then it is easy to take it forward in a global way.
Interesting take on globalization. So I have a follow-up question, because since everything is becoming modern, things are becoming global, and people are looking at Ayurveda in more integrative perspective, over time what will happen is people will be more in control and they will demand what kind of treatment that they want. And as we say, traditional medicine, so if it is a traditional medicine, there are tradition. How do you actually maintain traditional ways that the company has and traditional manufacturing ways that you have, and how are you basically coping up with the modern advancements in manufacturing, in practice management, and how entire healthcare has evolved?
So we can divide into three segments: education, medicine manufacturing, and healthcare. We include Panchakarma treatments, so all other treatments. So when into education, there was Gurukul system in the family earlier. We were learning and teaching Gurukul system in my family also. That shifted to college education right now. In 1970s, it shifted, 70s and 60s, it shifted to college education in our family also. So that is a part of education. Moving into manufacturing, earlier it was just some kashayas. Now we are related to kashaya tablets. So tomorrow it can go to any other drug delivery system. So that is the concept to preserving tradition. We are not changing the drug, we are changing the drug delivery systems. So there will be much more efficient drug delivery systems future. So drug can be maintained. So without utilizing much of the drug, by preserving nature, by taking the extracts or taking whatever required for the condition, with a better drug delivery system, we can deliver as a whole. So that is a change in the perspective of using the technology in the manufacturing of a product. But when you look at the process, we have a Herculean process of making a medicine. But now we have tablet punching machine. Earlier we used to hand roll pin roll this tablets. Shifted to a machine concept. Likewise, there are a lot of technologies around the world, but not completely adaptable. So we need to study how to adapt it in a better way. Earlier it was not used in Ayurvedic industry. Tablet machine or the bigger vessels for making arishtas was never used. Later, through continuous process of trial and error method, it was implemented. So it is, I would say, a continuous process. For Avarti, it's now Avarti capsule. So it's a change in drug delivery system, the same medicine, right? So the perspective has to be changed. Better drug delivery system has to be changed. When you look into Avartis, it's a lipid drug delivery system. What if the same lipid drug delivery system can be given to another drug which has got Rasayana effect? So concept has to be changed, but tradition should be preserved, technology should be utilized. And go to healthcare segment for treatments. Now the main issue is the cost of treatment getting too high because of the manpower, because of the cost of medicine. Cost of medicine can be controlled by the manufacturing. But the cost of treatment, including manpower, when you take a Panchakarma therapist, what all the things they are doing except the Panchakarma, that should be minimalized. Bringing something required for the treatment from X place to treatment room is not required. It should be done by other person. So this Panchakarma therapist can be utilized for a better service and add more value into that. Thus, we can save the cost adding up to the treatment. So we have to analyze each segment and add more value into that. Regarding research in the Panchakarma or the healthcare industry, is very much required. See, earlier it was 48 days or 50 days admitting a patient. But at this present scenario, we should accept that it's not possible. Admitting for 50 days, nobody can do it. But I won't admit anyone for 50 days unless it's a chronic, stroke patient. That only for 30 days maximum will admit. Later for rehab, we may admit, not continuously for treatment. In Ayurveda also, they say in 7 days we should reanalyze the prescription and change if and when required. Likewise, we should have yukti in that. So when you look into this that perspective of treatment and admitting a patient, there's a new way of thinking in healthcare industry to prevent thought process of a patient in a hospital. He's a human being with a difficulty just for the betterment he can. So we don't treat him or he or she as a patient right now. We take them as one of ourselves, give better quality to them as a service, as a treatment, as a whole. So whenever required, for example, the research in the perspective of a personalized food for them. We should adding a dietitian, more dietitian will add more cost to that. But there are certain platforms where they give free advice on regarding illness perspective of a food management in India. So why can't we use those platforms to give personalized food concept to patients rather than adding more cost to that treatment? So likewise, we should adapt technology, not even from Ayurveda, from other industries to utilize what is required for Ayurveda. That's what I would suggest in these three perspectives.
Very well elaborated. And in fact, I would call it my final question to you is, what strategies that does Vaidyaratnam group has been using and basically promoting to ensure the availability and accessibility of quality medicine? There's a big concern around quality these days, and people are talking around quality concerns in Ayurveda.
So, to make sure we have quality products, first thing is what we did was in the industry, manufacturing, we divided QC and QA from any other departments. Normally it's attached to some other departments. We are directly reporting to the board. So there will be no fluctuations because nobody can tell them to, okay, just forget it, just go for the products. We cannot allow them to do that. And they have the authority to reject or accept any product. If their parameters are not reaching, they can directly reject the batch of the product. To ensure that we have given the freedom to, first thing in industry what we have to do is, we have to give the people working in industry or the manufacturing freedom to, they should have a responsibility. It's not like a person sitting on the top should have a responsibility. Everyone working in that unit or in that organization should have the same responsibility. The first thing that we fostered is that. And moving to the process of quality, earlier we used to have senior Vaidyas in the industry, they're working in the manufacturing units, but post-COVID, they are elected to government and some of them passed away unfortunately, so issues are there. So what we did is, we use technology. We have some technologies around us, to find out the quality raw materials right now. For example, if you can take a photo in Google on a phone and go to Google Lens, they'll tell you which kind of product, object is that. So imagine using the same thing to analyze the raw material for a drug, of a combination of a drug at least. So it will tell you what kind of raw material is being used. So same way technology we are adapting to use better manpower in the manufacturing units. So apart from that, what we're doing is after the quality analysis, what we're doing is once the product is in the line of production, we have quality analysis in each step, not after the complete thing. Each step they have different set of parameters. And if that's been fulfilled, it will never go to step 2. So continuous inline QC we have developed to make sure we have quality raw material to quality products in the packing area also. From that, we advise the customers how to preserve the medicine because there's a huge difference in climatic conditions in India. In Himachal and all, we have winters, like you can go to snowfall and all. But in Kerala or in Tamil Nadu, it's totally different. According to region, the storage of medicine should be also changed. Otherwise, there will be an issue regarding the quality of the product. So we teach how to preserve the products in their respective locations also. Until that's done, it will not be a complete quality thing. Otherwise, the end customer may feel that this product has some quality issues. So accordingly, we have to teach them, and it's a continuous process, I would say.
Wonderful. Thank you so much. It was such a great experience talking to you. Thank you so much for watching the show. I am delighted to have Dr. Mooss today, and I'm looking forward to the program once again. I'll be back with another episode of Light, Camera and Action very soon. Till then, thank you so much. Bye-bye.